We are honored to once again be joined by Dr. Ali Houshmand, who is president of Rowan University. Good to see you, Doctor.
Great to see you as well, Steve. Good to see you. Happy New Year.
Yeah, same to you. We're taping on the 2nd of February. You can still say that. It'll be seen later. And to disclose, Rowan is one of our higher ed partners. Doctor, let me ask you, as we tape today on the 2nd, it'll be seen later, as I said, Rowan is very involved in the vaccine distribution. Yes. The COVID vaccine distribution. What has been your experience to date, and why is it that a university is so actively involved in that plan?
Well, to begin with, we have the infrastructure and the personnel. You obviously need individuals who are qualified to take care of the patients, the people who come in, for not only registration into the electronic data system, but also, giving the vaccination and watching them for 15 minutes after the vaccination to make sure everything is okay. You just cannot put any random person in there. We have 2 medical schools. Between them, we have well over 1,200 students in these 2 medical schools. And even if you get 10% of them volunteer, you're talking about 120 individuals who are plenty capable to help. And that's really what the country needs today. The problem that we have, and you hear it every day throughout the nation, is that, the most advanced country, the most strategically capable country with resources cannot get the handle of this thing. And the reason is because of the failure of the logistics. The pieces are there, they're just not interconnected. And I think one thing that we have done here at Rowan is we have connected them, and we have been very successful. Really, we are doing a great service. People are coming in, getting their vaccinations, and going home, and we are very happy. That's really what we need to do for everybody.
But I'm going to follow up on this because we spoke to Dr. Thomas Cavalieri, who was with us, and it was a great interview. Check out our website, steveadubato.org. You can see that. But I'm going to ask Dr. Houshmand this because he also joined us on our sister program, Lessons in Leadership. And he and I talk leadership a lot. So I got to ask you, Doctor, forget about the clinical aspect of this. As a student and practitioner of leadership and logistics, how frustrating is this for you? And you and I just were joking before we got on the air. We're not very patient people. How frustrating has this been for you?
It's been hugely frustrating because the fact of the matter is, Steve, we can do a lot better than that. We really can. For example, the moment that the vaccination started, and I went and visited one of these mega sites over at the Rowan College of South Jersey, and I looked at and counted the number of parking spots, the distance that they had to walk from parking spot into the place where they get registration, from there where they walk into a place where they have to get the injection, and then, sitting somewhere to rest for 15 minutes. I found that the system is not put together in a scientific way so that they would very quickly will create bottleneck. This is winter. You do not want, the last thing you would want is people staying outside in the cold, or you'd be forced to put them inside in a congested area with not enough airflow and get them infected. So that logistical system is really easy. In fact, that's what immediately I did. I went to a virtual reality system lab. You have been there. And we did actually a simulation of that thing. Is a fascinating. I wish I'm going to send you I'm going to send you a clip of it. You're going to be fascinated by seeing the human being walking in here, each of them color coded, whether somebody is infected or not infected, how they get injected, how they get, registration, everything is done. And you can very quickly see the bottleneck is being created. And then we tell people, if you change certain parameters, for example, increase the number of registration or shorten the distance from parking to the registration, all of this, suddenly the system works better. So we have put this thing together, made it available. We would like to make it available to the rest of the state and the country indeed. And this is a fascinating simulation model. It applies to any system, and people can use it. And that's really what I did. I said, what is the opportunity? What can I do as a person who understands operations, research, and logistics? How do I help? Immediately went to that solution. And I think there are thousands of individuals and universities in this country who can do likewise. This is not the rocket science. This is not a difficult problem, but it's one that really we need to do right now. Because the sooner we get people, 80% or so of people injected and vaccinated, immunity, the sooner we can get back to some sort of normal.
So, Ian, by the way, and I've been to the laboratory that Dr. Houshmand talks about. The simulation's extraordinary about a whole range of things. So this has been said to me many times, Doctor, and it's not about blaming, it's not about pointing fingers, but here's the thing. Steve, you don't understand, quote, it's complicated. I'm sure it is. But Dr. Houshmand, do you believe it's as complicated? You just said it's not rocket scientist. Okay, let's assume there was way more vaccine that's being developed as we speak right now on February 2nd. That doesn't solve the problem by itself because logistics, details matter. Go ahead, doctor.
I don't think it is that complicated. The order that the President Biden issued today using pharmacies to do vaccination is a wonderful thing. All we need to use every resources. One of the resources there are 4,000 universities in here. Use every single one of them. They have nursing programs. They have allied health programs. Chances are they've got medical school programs. And they have other experts in sciences who really can be quickly trained, or they probably are trained. And they have the infrastructure. They have parking. They have big facilities. Use these places, and the key to it, of course, have enough vaccines. But that's what we need to do, because relying on mega or big center, these are not going to cut it. There are people who are going to have a very, very hard time to get a cab or to have a car to drive to one of these centers. We need to find every which way we can to reach to as many people as possible, as soon as possible. And it's not really that complicated.
You know what, I'm going to ask Dr. Houshmand, I did this to you the same thing last time. We have 30 seconds left, but there are a couple other items I want to talk to you about. If you could stay right there, I'm going to ask Dr. Houshmand to join us. We're going to do a segment for our Lessons in Leadership program that I co-anchor with my colleague, Mary Gamba, who is the executive producer of that series. Leadership and logistics. You just got a taste of what Dr. Houshmand is talking about. I'm going to talk to him more on our Lessons in Leadership program as well. But for this edition, I want to thank you, Dr. excuse me, and all of your colleagues down at Rowan for everything you're doing every day. And let's just agree that when it comes to people like you, like me, patience is not our greatest virtue.
No, it's not. No, it's not.
Thank you, Dr. Houshmand. I'm Steve Adubato. That's Ali Houshmand from Rowan. Thanks for joining us. We'll see you next time.